Good morning, everyone. Today, under pathophysiology, we're gonna discuss about the last topic in pathophysiology, that is the disruption and disorders of musculoskeletal system. And also in this video, we gonna discuss about the assignment for the completion, and the assignment discussion also will be done during this video. So first of all, I would like to pay attention on the musculoskeletal disorders or pathologies, which is the ninth topic of the pathophysiology learning guide. Right, under musculoskeletal pathologies, we have main diseases. What are those? First, that is the osteoporosis. Then we have rickets. Then osteomalacia, Paget's disease, myasthenia gravis, fibromyalgia, osteoarthritis, rheumatoid arthritis, and gout. You can refer to these things when you get the presentation. So, according to the slides, we will discuss what are the main diseases. First of all, we're going to discuss about osteoporosis. What happens here? The bone density decreases, or the normal, you can see here in the picture on your left the normal density of a bone, and on picture on your right you can see how does an osteoporotic bone looks like. You can see there are pores and there's less density compared to a normal bone. So that is the main mechanism what happens in osteoporosis. Again, what mainly happens you can understand from this diagram itself. Here you can see real photograph of a normal bone. How does it situated and looks like an osteoporotic bone after losing its density. So these bones are very much feasible, or these bones have an increased tendency to break because they don't have this strength. They have lost their density. Osteoporosis, a chronic progressive disease of multifactorial etiology. Most common metabolic bone disease. Low bone mass and microarchitectural deterioration of bone tissue. This disease is a silent thief that generally does not become clinically apparent until a fracture occurs. Normally, how does a patient gets diagnosed with osteoporosis? When there's a fracture. When the fracture occurs, patients, they go and they check, and then only they get identified that they are having osteoporosis. So this disease, we call it a silent thief, because that generally does not become clinically apparent until a fracture occurs. And as we mentioned, low bone mass and microarchitectural deterioration of bone tissue, and that is the most common metabolic bone disease. Then what are the risk factors for osteoporosis? Personal history of fracture as an adult, history of fracture in a first degree relative, being a white race, advanced age, female sex. This happens mainly due to breastfeeding, and dementia, poor health or fragility. Those are the risk factors for osteoporosis. Then we have another disease that's called rickets. What we have here, the bones become curvy and are easily breakable. They become or there's increased tendency to break, and this happens mainly due to vitamin D deficiency. Vitamin D is a hormone that increases calcium reabsorption from GI tract. Vitamin D is a hormone that increases calcium reabsorption from GI tract. When vitamin D is deficient, or when there's not enough vitamin D, the calcium reabsorption also decreases. So that is the main reason for rickets. You can see here legs, rickets, and here also ricketsy legs, here also curvy bones. Then we have Paget's disease. Look how it has been disfigured. The skull has disfigured in a person who is suffering with Paget's disease. Here also you can see how does a person appears who is suffering from Paget's disease. Here you can refer to these photographs when you get the presentation, which is in Moodle. Osteoclastic overactivity followed by compensated osteoblastic activity leads to a structurally disorganized mosaic of bone, or we call that a woven bone appearance. Disorganized mosaic or disorganized bone appearance is the main clinical symptom of Paget's disease. Etiology or the reason is unknown. Here, the etiology of reason is unknown. Paget's disease does not spread from one bone to another, and new sites of involvement are rare after initial diagnosis. That doesn't spread normally. Elevated levels of alkaline phosphatase is a marker. Elevated levels of alkaline phosphatase. Then we have myasthenia gravis. That's a rare autoimmune disorder which causes skeletal muscle weakness. Antibody-mediated blockade of neuromuscular transmission happens here. Autoantibodies from against the nicotinic acetylcholine postsynaptic receptors at the neuromuscular junction of skeletal muscles. Now, this is the postsynaptic membrane. This is the neuromuscular junction here. There, the postsynaptic membrane becomes the antibodies from against the nicotinic acetylcholine receptors at the neuromuscular junction of skeletal muscles, present with painless specific muscular weakness. Pay attention, that's painless. No generalized fatigue. Droopy eyelids or double vision is the most common symptom at initial presentation of myasthenia gravis. Droopy eyelids or double vision is the most common symptom at initial presentation of myasthenia gravis. That happens again due to an antibody blockade of neuromuscular transmission at NMJ or neuromuscular junction in postsynaptic membrane or postsynaptic membrane in neuromuscular junction of skeletal muscles. Then we have fibromyalgia. What is this? Fibrous tissue and muscular pain. That's a chronic disease, chronic muscular pain, and that's more common in females than in males. Main symptoms are widespread muscular pain, extreme tenderness, sleep disturbance. You won't be able to sleep in a peace of mind. Etiology is poorly understood, not completely understood, but related to increase in pain perception. Etiology related to increase in pain perception. Then we have another disease, that is osteoarthritis. In osteoarthritis, what happens? That's the deformity of these joints could happen. Bone and joint inflammation, we can say, that mainly happens in synovial joints. Chondrocyte control the constant cartilage remodeling. Pay attention to this third point. Chondrocytes control the constant cartilage remodeling. When something causes increase in breakdown of cartilage over making cartilage, osteoarthritis occurs. When something causes increase in breakdown of cartilage over making of cartilage, when the breakdown is higher than the production, osteoarthritis occurs. Joint mites once in the synovium will cause synovitis. After cartilage is gone, we have bone eburnation, osteophyte. Then we have osteophyte formation. What are something? We said when something here at the fourth point means something causes increase in breakdown of cartilage than production of cartilage. What are these somethings? Increased age, previous injury, inflammation, mechanical stress, and obesity. Symptoms are morning stiffness. Your bones become very stiff early in the morning, but that's less than 1 hour. Comes back at night. That occurs again at night. Sharp ache, burning pain, worsens with activity. Usually there's no swelling. Then we have another disease which affects musculoskeletal system, that is rheumatoid arthritis. That's an immune mediated disease. Genetical and environmental factors are there. T cells, what happens here? T cells come to the joint and invite macrophages to join by releasing interferon and interleukin. These macrophages, what happens here? T cells come to join and that invites or that stimulates macrophages to join and release interferon and interleukin. Macrophages, they release TNF. What is that? Tumor necrotin factor, interleukin 1 and interleukin 6, which will cause, these things will cause synovial cells to proliferate. We call that pannus. Pannus goes into damage the cartilage and bone, and that causes rheumatoid arthritis. Symptoms of this are multiple joint involvement. Normally more than 5 joints are involved, and that's normally symmetrical, happens in symmetrical joints. Over the time, joints get swollen. As disease progress, joints get stiff in the morning, lasting more than 1 hour. Stiff in morning, lasting more than 1 hour. Here you can see how these deformities has occurred. For rheumatoid arthritis and all, we have different criteria of diagnosing and all, but we are looking at this rheumatoid arthritis and its musculoskeletal disorders superficially. When we get to see you at the IIHS premises, we will do this in detail. Then gout build-up of, that's an accumulation, a build-up of a uric acid. We call that condition hyperuricemia. Uric acid forms crystals in joints, and as you know, this mainly or famously affects the big toe. This condition, or the big toe, this gout, when it affects, we call it podagra. How it happens? Increase in uric acid can occur with what? Excessive meat consumption, dehydration, excessive alcohol intake, obesity or high BMI, and diabetes mellitus. Due to these reasons, there's increase in uric acid, and that build up and accumulates in big toe, and that causes gout. But famously, even though that famously affects the big toe, that can affect any joint. What are the main symptoms? Patient wakes up at night with toe on fire. That's a severe burning type pain with toe on fire, we say. Pain lasts for hours, maybe up to days, but will resolve. That resolves spontaneously. Complications are repeated gout attack. This may happen again and again. Arthritis and tissue destruction can happen. When it happens repeatedly, that can cause arthritis and tissue destruction. And increased amount of uric acid may cause kidney stones, and also urate nephropathy. Then about anemia. For anemia, the main causes we will see, that could be excessive red blood cell loss or inadequate red blood cell production. You can refer to these things when you get the presentation. This is about hemolytic anemia and symptoms of anemia and alterations in pulmonary function You can refer to these things once you get the presentation. And now I would like to move on to the assignment.